Good afternoon. Welcome back. It's truly an honor to be here with all of you, researchers, clinicians, people living with ALS, caregivers, advocates, and partners who share a belief that progress is possible and that a cure is within reach. That's me. I'm Laura Freveletti, CEO of the Les Turner ALS Foundation. It's been a challenging year for, I think, all of us. Hande talked about the stress and uncertainty she felt, which many of you also experienced, when critically important funding was put on hold with little warning or explanation. That stress is rooted in the commitment we all share. We know the cost of a day, a lost day in the fight against ALS. So how do we move forward in times like these? Let me take you back a few decades to where the Les Turner ALS Foundation began. In the words of his best friend, Les Turner was a special guy. He was diagnosed with ALS at 36 in a world very different from this one. There was no compassion from the clinician who delivered his diagnosis. There was no foundation he could rely upon for support, and there were no meetings like this one that he could look to for hope. Things had to change. When Les Turner's family and friends partnered with Northwestern University's medical school in 1979, something extraordinary happened. Together, they launched one of the country's first laboratories devoted exclusively to ALS. That bold step created a scientific home for ALS research in Chicago. It became a candle in the darkness for people like Les. That partnership has not only stood the test of time, it has flourished. Northwestern has made our cause their cause. In their recent commitment to endow the Les Turner ALS Center at Northwestern Medicine in perpetuity ensures that the discoveries, hope, and care born will continue for generations to come. Our shared legacy is not just one of history, but of impact. Over the years, the Les Turner ALS Foundation has raised more than $80 million to drive groundbreaking research, advance treatments, and deliver unparalleled support for people living with ALS and their families. A lab at the Les Turner ALS Center co-discovered the first genetic link to ALS, SOD1, paving the way for the first FDA-approved therapy for a genetic form of ALS, which held clinical trials here. Today, more than 70 researchers and clinicians at the Les Turner ALS Center are advancing a deeper understanding of ALS, accelerating treatments and biomarkers in neuroprotection. Through our world-class, multidisciplinary Lois and Solia ALS Clinic, led by the incomparable Dr. Driss, we deliver expert personalized care while helping propel clinical research forward, hosting trials, testing new therapies, ensuring that scientific discoveries translate into better quality of life as quickly as possible. In a few minutes, you'll hear from Evangelos Kiskinas, who has a tremendously exciting paper in the latest issue of Nature Neuroscience. Sadly, Evangelos isn't talking about that today, but he's introducing our keynote speaker. So I would encourage all of you to ask him about that when you have a chance today. If you have listened to the conversations today, it's clear that connections are fueling discoveries. In times of stress and uncertainty, we find resilience in connections and partnerships. So let me highlight just a few that we're excited about. We're proud to partner with the Healy Center for ALS at Massachusetts General Hospital. Together, we are expanding access to innovative trials and care, a collaboration that will lift outcomes not only here in Chicago, but ALS clinics worldwide. ALS My Match is an innovative, multi-center, biomarker-driven trial initiative aimed at bringing new efficiencies to early-phase ALS trials. The importance of early-phase trials cannot be understated. Well-designed early-phase trials set the foundation for all drug development, identifying the optimal dosages for future testing, solidifying biomarker responses, and honing the appropriate trial population. Another exciting partnership is the Silence ALS Network. This initiative, co-founded by Columbia University and the N. Lorem Foundation, aims to develop personalized gene silencing therapies for patients with ultra-rare genetic forms of ALS. It provides an infrastructure to identify, treat, and fund individualized treatments for these patients who lack other options. So even as challenges arrive, we're moving forward together. We're finding answers. Just a few months ago, the Les Turner ALS Foundation invested $500,000 to ensure that the critical research at Northwestern will continue without pause, because people with ALS do not have time to wait, and neither do we. We're driving a future where ALS is not only treatable, but livable and ultimately curable. Our optimism is rooted firmly in science and the strength of this community. Thank you for being here, for your dedication, for your passion, and for your perseverance, for putting people living with ALS at the center of everything you do. I want to invite you all to put a note on your calendars to join us next April on Saturday, April 11th. I'm looking at Peter in the back who corrected the date, so thank you for calling that out. Also, in just 2 years, the Les Turner ALS Foundation will celebrate its 50th anniversary. It's a milestone that invites both gratitude and excitement. Gratitude for the visionaries who started this work from a place of love and urgency and excitement, because we're closer than ever to meaningful breakthroughs. So before I turn things over to Evangelos, let me take you back one more time to a family at a crossroads after an ALS diagnosis. I take strength from their story, and I hope you will too.
Les Turner grew up in Oak Park, Illinois. He was a unique guy. He was very personable, very intelligent, exceptionally smart.
Les Turner was married to my sister Ina, so he was my brother-in-law. Ina and I were very close. Harvey and Les were very close, closer than brothers.
We spent every day together, vacations together. It was just a special friendship. January of 1976, he went into Evanston Hospital for a diagnosis. Dr. Vick walked in at 6:30, stood at the foot of the bed, said, "Les, you have amyotrophic lateral sclerosis, ALS. It's terminal disease. You have 2 to 3 years to live," and walked out of the room. There was absolutely nothing about ALS. There wasn't a pamphlet, there wasn't a brochure, no research, nothing to tell you about the disease. There was nothing. Les Turner, I think more than anything, he didn't want others to suffer. He didn't want other families to suffer as he suffered. We had this goal of establishing the first research laboratory in the world devoted solely to ALS research. So in 1977, we started the Les Turner ALS Foundation.
We started it almost as a fun fundraising organization. The first event that we had, it was the Artist Night Out. We raised an amazing $5,000. We had another event at Sportsman's Park. We had a horse that had a Les Turner ALS Foundation blanket on it. We raised $3,000. So now we have $8,000, which we thought, wow, we're on our way. We got press. Bob Green wrote an article about Les that just opened things up. But we started getting more and more publicity. And then my sister Ina was cleaning out the basement and brought out a stack of LPs and put them by the curb. And Les saw people rummaging through the LPs. He came up with the idea of the Mammoth Music Mart.
Les died April 14th, 1978. He didn't get to see the music sale, but we pulled it all together. People came from all over the world to shop the music sale. It was happening on the North Shore of Chicago. It was something very special. The spirit that existed in that tent was just incredible. We said, if we're going to do a music sale, we need a general chairman. And somebody said, well, why not Dick Clark? I mean, he was a major music figure. And so we wrote him a cold letter about Les Turner. And lo and behold, he did agree to be the general chairman.
Hi, I'm Dick Clark, honorary chairman of the Les Turner ALS Foundation's Mammoth Music Mart for Lou Gehrig's disease.
That was really a game changer for the foundation because of many PSAs that he did. He got radio stations to come to the tent and sign autographs and do a little emceeing. We opened and closed every sale with Barry Manilow playing This One's For You.
Barry Manilow, this one's for you.
I think I teared up every time because the words just seemed so appropriate. This one's for you, wherever you are. We funded that first research laboratory at Northwestern. They really made our cause their cause. And it was really a partnership of shared values. I'm so proud of that relationship.
The foundation has done so many things to help. People now are living with ALS and have some quality to their lives.
I can't tell you how often I get calls from ALS patients or families. Harvey, what do I do? Where do I go? Being able to help them is just enormous. Giving them some hope, somewhere to go, someone to meet with, someone that's going to give them direction. There was nothing like that when Les was diagnosed. Nowhere to go.
Hope. It's giving hope to the patients. I am honored and grateful to have been with this from the beginning. Even though it's a multifaceted disease, we're going to find these answers, and we're going to have that world free of ALS.
Don't give up. Don't ever give up. That's the future of the foundation. No one's giving up. This one's for you, Les.